Hi, my name is Harry Lee, and I am a senior attending at the Mount Sinai West Hospital in the Department of Obstetrics and Gynecology. I am a native New Yorker, born and bred here, educated here as well. And I started at the Mount Sinai West Hospital as an obstetrician gynecologist back when it was still the Roosevelt Hospital in 1994. So I go back a little ways. My interest, I'm a general obstetrician gynecologist. I deliver babies, and I do gynecologic surgery as well as routine gynecologic exams as well. Yes, it's actually very safe to come for prenatal appointments as well as to deliver at the hospital. And I understand with the COVID-19 pandemic, there's a great deal of concern over leaving the home and coming out, and concerns regarding social distancing, being around other people, and sanitizing surfaces and areas that other people have come into contact with. The Mount Sinai West Hospital has instituted some pretty rigorous disinfection protocols, both for the outpatient facilities as well as the hospital themselves, both for the public areas as well as patient rooms that have previously been occupied by other patients. Now, in terms of the outpatient offices, the staff all wear masks. Patients are screened prior to coming into the office for COVID symptoms, and the staff is screened daily before work as well. Oh, absolutely. Mount Sinai is open to patients within the city as well as outside of the city, and many of our patients do come from outside of the city. Some of our patients during the pandemic have relocated to places outside of the city, like upstate or Long Island, but still intend to come back to Mount Sinai for delivery. And many of our visits are done through telehealth visits. Certain aspects of prenatal care do require leaving the home, such as having blood taken, but it can be done locally at a local LabCorp lab near wherever you're staying. Prenatal ultrasounds, though, will need to be done at an obstetrical ultrasound facility, and there are generally 2 of those scheduled during the course of prenatal care, and those would also involve leaving the home. But for the most part, most of it can be done remotely. Your birthing partner absolutely can be present for the delivery. We do encourage it, and we know that having that support person is really important to get patients through a very difficult part of the pregnancy, which is going through labor and giving birth. Partners are also allowed to be on the postpartum floor, and prior to being admitted to the hospital, both patients and their partners will be COVID tested for everybody's safety. And in addition to the partners, on labor and delivery, doulas are welcome as well. And upon admission of the patient will also be COVID tested. Well, one of the other things is the safety of the patients is paramount. Labor and delivery at Mount Sinai West occupies the 11th and 12th floors. Labor and delivery, postpartum, the nursery, and the neonatal intensive care unit occupy the 11th and 12th floors of the hospital and really operate in isolation. When laboring patients come into the hospital, they go directly to the labor floor and bypass the emergency room and are admitted from the labor floor. We have our own operating rooms. We have our own recovery room. And as I said, the postpartum and the nursery are also within our own locked units. And none of this has ever been co-opted to be used as a COVID unit. So we operate as an isolated pod within the hospital, which should give some measure of comfort and safety to our patients. And thank you for tuning in today. Hope to see you guys soon.